A flurry of changes in the first week of the second Trump presidency will break down the most significant action and the rising cost of health care. My conversation with Trisha Keith. Today is Sunday, January 26, 2025, and this is Flashpoint. Hi there, and welcome to Flashpoint. I'm Christy McDonald. So glad that you're with me on this Sunday morning. We are almost a full week into President Donald Trump's second term, and already his first executive orders and actions are setting off lawsuit and debate. From immigration and sanctuary cities to cutting federal DEI programs to attempting to restrict birthright citizenship. There is a lot to look at when it comes to Michigan. Plus, the governor's race here just got a whole lot more interesting. Secretary of State Jocelyn Benson jumps in for the Democrats. Who's next? We'll talk about it all with our roundtable. And then the new CEO of Blue Cross Blue Shield of Michigan, Trisha Keith. She gave her first public speech after making headlines this week, announcing voluntary buyouts. I go one-on-one with her about the price of health care and prescription drugs. Stay put. Flashpoint starts right now. Let's get started with our roundtable on President Trump's first week in office. With me is Stephen Henderson, founder of Bridge Detroit. Next to him is Andrea Bitely, PR pro and contributing conservative columnist at The Free. On my left, Portia Roberson, the CEO of Focus Hope, and Jason Rowe, political communication strategist at Rowe Strategic. It's good to see all of you. I tried to write down everything that happened in the news this week, and I had not enough paper or the list to bring in here. But I wanted to start, I think, just by taking a breath and a moment and go down the line a little bit and tell me the one or the two things that have stood out in all of the things that we have seen this week. And I am going to start with you, Stephen.
Oh, my goodness. One or two things.
That have concerned you or or surprised you or have stuck out the most, because there's a lot.
Okay, well, let's start with executive orders. And this is a bit of a bipartisan gripe, but there are substantive differences between Democrats and Republicans in the way they use them. But the number of executive orders on the very first day of the Trump presidency really bothered me. Substantively, there were a few that jumped out as more problematic than others. Canceling the anti-discrimination policies across the federal government and then sending a nasty email about it the next day, which they did to all federal employees, I thought was petulant and impulsive. Back to the last 4 years when he was president, when this was the kind of behavior that we saw all the time. I didn't care for that, and I don't care for him deciding that birthright citizenship is somehow not in the Constitution or irrelevant because it's in the Constitution. I think we're on a really dangerous path there.
Those are two things that we are going to talk about. Andrea, what kind of stuck out for you for everything this week?
Honestly, the lack of surprise. What Trump has been rolling out over the past week are exactly what he said he was going to do on the campaign trail. Anyone who has really been paying attention expected birthright citizenship, expected an end to DEI programs in the federal government. They expected each and every one of these proposals to become reality when he got into office.
And I think, Portia, though, when you look at everything, and yes, a lot of things were expected, I think people also runs through their mind saying, is this normal? Is this the cadence that we're supposed to see from every now incoming president in terms of the volume?
Well, I do think it sets a precedent for incoming presidents in the future. Like day one, put a desk out at your rally, start signing executive orders within the first few hours.
But it is all about show for Trump. He's very cognizant about how he does that.
He is. I will tell you what I have been surprised about, to echo Stephen, most of those things. But I've also been very surprised at Republicans who are surprised that these things are affecting them in the way that they are, because he did say, I'm going to go after these things. And so, social media has exploded over the last week. And, I saw one young man, or one middle-aged man, I guess, say he was upset because he and his wife had invested money in moving from one place in Texas to another place in Texas, and her job at the VA had been rescinded. And it's like, this is exactly what he told you he was going to do. So now he's like trying to get everybody to tweet to Donald Trump, because he didn't expect it would happen to him. He expected it to happen to other people. And for it to happen to him, him. He's just shocked and amazed. And so I think for me, it's been the lack of paying attention to the things he told us that he was going to do and the effect that it's having on people who are big Trump supporters.
So we see the impact now. People are starting to see the impact. What are your thoughts this week, Jason?
To me, it's the sheer volume of things that were done. I mean, this was the most aggressive and ambitious assault on government and how we govern across the board that we could ever imagine. And you said in the intro about all the news that was created this week. That's by design. There's no way for us to focus on any one thing that we might like or be outraged about, because there's so much to choose from that you can't ever kind of get everybody focused on any of those things. And when you look at pretty significant changes. Some of them I would call extra legal, and they'll work their ways through the courts, but I think send a message. But when you talk about regulatory policy, you talk about taxation, you talk about trade and tariffs, you talk about the things that he's doing at the border. He went and spoke, via Zoom to the World Economic Forum in Davos and pretty much dressed those guys down. And it was really remarkable watching even his reception. They were feting him. I mean, they were genuflecting to Trump, and that is a group that has historically been at odds with him on a lot of foreign policy, trade, tax, not as much regulatory items. So to me, there's a lot of molecules bouncing around right now. There's going to be a lot of pain for certain constituencies. How this plays out, I mean, there's going to be some broken glass on the floor, but we've never seen anything like this, and I don't think people comprehend what a huge shakeup we just witnessed.
Yeah, I mean, there's so much to keep track of. We talked about, and Andrea, you said that you're not really shocked or surprised because everything that he's talking about, he had talked about ad nauseum on the campaign trail. I think, though, when chaos starts to get a little dangerous or when people feel uneasy is when you see communications from the National Institute of Health have to stop, or external communications or meeting about funding for cancer research, that everything's on hold for several weeks right now. What can the Trump administration do along the lines of some of those things to say, all right, hang on, to try to make people feel a little bit better by all of the change all at once?
Sure, I don't think the Trump administration is going to do anything to say this is going to be okay in the end.
Essentially, it's like,
this
hang
is exactly
on, this
the plan.
is it.
This
Yeah.
is the plan. It is a chaos introduction to those of us that remember the previous Trump administration. You constantly had to be on Twitter to know what was going on in the world, or now I guess Truth Social, to know what's going on in the Trump administration. No more will it be, NBC News gets an exclusive. Now it's going to be, we're running this on our blog, our YouTube stream, et cetera.
The linear media, forget it, is going to be out of the loop in terms of getting that direct information. Stephen, I want to go over to you because you brought up the DEI initiatives that being cut at the federal level. And it makes me think about some of the programming that even impacts here in Michigan when we talk about environmental justice. When you wipe away everything, is it wrong to wipe it all away or bring back some of the things that we know that there are healthcare disparities coming out of COVID? We know that there are maternal mortality disparities when it comes to African-American women and white women. What is the danger of just wiping everything out at once?
Well, this is why you don't govern by executive order, right? I mean, because you don't have the ability to make those finer distinctions. You don't give people time to have a debate. I don't know, let's take it to Congress and have them talk about it and put their ideas on the table. But that would give him too much credit, right? I mean, this is not a substantive policy move. This is a nod to, quite frankly, the racists who are among his supporters. There are a lot of people in this country who believe that black and brown people, that disabled people, that all kinds of other people have too much, have gotten too much, have gone too far, and Trump has been signaling for a long time, I will take care of that for you. I will push it back. And by doing it this way, he can say he did it, right? He doesn't have to debate these finer points or make it make sense. He delivers for that constituency.
Can he also say, but there are other things in place to protect?
Well, I wished he had said that, right? I wish he had said, we're getting rid of this, but it doesn't mean that people will suffer the same kind of discrimination they did before these were in place. He didn't even address that. He didn't even go to the point of saying, well, we'll do this instead. The email they sent to all federal employees simply said these were a waste of money and engendered racism. They made racism worse. That's their position.
Portia, let me ask you, in terms of when we look at what's happening immigration-wise, we know a lot of families are just, again, this is this unsettling feeling of what will happen next and wondering how these policies are going to be playing out.
Well, listen, we at Focus Hope, we run a senior food program. There are two things that came to mind immediately. One is that in 2016, President Trump got rid of the commodity supplemental food program, Xing out food for seniors. We feed 43,000 seniors a month. That was gone. Luckily, Congress, because he didn't do it by executive order, brought that back. We're feeding through 9 counties in Michigan. So it's not just Wayne County, it's Oakland, it's Macomb, it's all the 5 counties in the thumb. So that's one of the things that comes to pass. The other thing is, yes, the immigrant population, we are afraid that they won't come to Focus Hope and ask for the help that they need because we require information. We require your name, your household, who's living there. People don't want to give that information in this moment because they're afraid that the next knock that they'll hear at their door is ICE. So these are real consequences around these sort of policies that he's enacted in the first week.
Jason, give me the, it wasn't all bad this week kind of thought.
Well, to Andrew's point, he said he was going to do this, and a majority of Americans elected him to do a lot of these things. And when you look, the New York Times, of all publications, came out with a poll this week. 87% of Americans want anyone accused of a crime who's here illegally deported immediately. And a lot of things that you might think were too draconian in terms of immigration and deportation had majority approval. They don't want to separate families. They don't want to see ICE agents going into schools and churches and things like that, had public opinion against it. But on those other things, this is what voters voted for. I can tell you, having run elections in the last election, immigration was the #2 issue in nearly every single poll. And so I understand for those people that are going to get caught up in this, but the idea that we can continue to tolerate millions of people coming into the country illegally and turn a blind eye because some people are going to get caught up in the reversal of these policies. I do think we're going to get to a point where it's not going to be going into schools and churches. It's going to have its own chilling effect on people that are on their way here or are here illegally who don't want to spend their lives living in the shadows and looking over their shoulder because ICE might be around the corner. So a lot of this will self-correct the net migration into the country.
And the birthright citizenship is being challenged in court. They put a stay on that. Yeah, and Andrea, I'm going to give you the last word in terms of what we should be looking for now in the next couple of weeks.
I think we're going to continue to see executive orders roll out, but I also think we're leading up to Congress really Congress really moving through all of the cabinet officials. And so we're going to see changes in the cabinet positions. We're going to see people coming out and really seeing cabinet level officials in place and put in power.
No shortage of things to talk about. Stephen, Andrea, Portia, Jason, thank you so much for being with me. Coming up next, the new CEO of Blue Cross Blue Shield of Michigan, Tricia Keith. We go one-on-one to talk about headlines that she made this week with voluntary buyouts and the rising costs of prescription drugs. Stay with me. Welcome back. This month, Tricia Keith took over as the new CEO at Blue Cross Blue Shield of Michigan. Definitely a tough time for the industry as a whole. She spoke at the Detroit Policy Conference this Thursday, her first public speech since taking the helm, and already announcing some tough decisions. Talk a little bit about what made headlines this week in all of the papers, that you are offering voluntary buyouts to employees, trying to cut $285 million this year alone, with a total of $600 million over the last several years, citing the financial pressure that you've talked about and also increased utilization of healthcare services. Talk about what that decision was for your employees, and then how you tackle those costs when it doesn't seem that they're going to be, or those challenges are going to be coming to an end.
Those challenges aren't going to be coming to an end, and that's why when we're finished with this transformation, we will continue. We will start on with the next one. When I gave my comments, I talked about that 7% of your dollar and where it goes, and it's on us to make sure that's efficient as possible. I would share. It's interesting, that the headlines that got. We believe that is very consistent with our culture, in that one of the great things about this company is you have generations of people who work in this company. In greeting the doors with people, I've had moms and daughters come together to shake my hand in these first couple of weeks. It's exciting. And we want to honor the history and the legacy of the people who have worked there, with people being able to self-select and say, this is my time. And that's why we decided to do it this way. And so, most businesses are looking at the cost of what it costs to do their business, and we're doing it, and we believe we're doing this in a culturally sensitive way to hit our goals.
You talked a little bit about COVID-19 and how prices and things have changed up now to 2025. We would have thought that maybe we would see some of the financial pressure back during COVID. So tell us or explain a little bit more in detail why it's catching up with everything today.
Well, I would say, it's really interesting when natural disasters happen, when pandemics happen. Generally, people continue to pay their premiums, but they don't seek the care. A lot of the elective things go away because people are so focused on the issue at the time. That happened during COVID. Think about the amazing work that our hospital and physician partners did during that time in really focusing on those who needed it most. And there were a lot of knee surgeries, for instance, that got put off. And so that for a very short time, that was depressed. Well, what also happens then is we saw screenings go down. We saw vaccinations go down. We saw all of those things happen. There's a price to pay for that. It catches up. And so now when you go back for some of those treatments, it costs more, not only because of inflation, but because, God forbid, the condition may have gotten worse. And so all of those things are catching up.
So I guess how would you form and list for us some of the biggest challenges and maybe frustrations that customers have right now with healthcare? Is it the cost of prescription drugs? Is it the premiums?
I think there are a lot of things. What we've learned is there are a lot of people that are frustrated with our industry right now. If we start with prescription drugs, however, the issue is as much the price of drugs as the cost of drugs. And I would submit to you that, and I'm not a huge one for government intervention, at the same point, how is it that GLP-1s are priced at $16,000 per person per year? It doesn't cost that anywhere else in the nation, in the country, in the world. And so that needs to be addressed as well. I think we're going to get to a point where that has to happen. Certainly that's an issue. And I think it's really important for people to understand that not all healthcare insurance companies are created equal. And so one of the reasons why when we speak, we talk about our nonprofit mission and about how our job is actually to cover people. That's what we try to do. And so we do believe we're significantly differentiated from some in the industry, and it's up to us to tell our story and prove it to our members.
And kind of navigating the road as people try to figure out the cost of procedures or where they can go for a doctor or those prescription drugs. What are you putting in place to, I guess, help people's experience when they're interfacing with their insurer?
This is a lot of what I just talked about relative to a lot of the innovation in the AI. We understand, our premise was healthcare can be complicated. And so we want to make sure that we're investing through AI and through technology to make sure that the digital tools we have are clear, that we have transparency in pricing with our hospital partners, with our physician partners, and frankly, that we create shared outcomes and shared objectives with them to make sure that we're all working together to knit that system together to make it the best customer experience we can for the member.
It's no secret that people can get very frustrated with healthcare, with insurance, and we saw that play out in December with the murder of the United Healthcare CEO. I want to ask you how that maybe has changed what your experience is as now leading Blue Cross Blue Shield of Michigan, and what your thoughts are as we saw this unfold.
Well, first of all, you almost can't speak about the tragedy, and that there's nothing ever justified such as that which happened there. And so our hearts and prayers go out to all the United family and the Thompson family in particular. I would tell you it probably wasn't the best time to become the CEO of a health insurance company, but this is a job and this is a privilege, and it's why we're out talking about what we're trying to do for members, how we're trying to cover people, and how critical it is that we work as a system. I would say that our employees took that very deeply and very seriously as well. One of the great things about our company is in all of our internal organizational alignment surveys, the number one thing that keeps people working at our company is commitment to mission. And what they want to do is cover people. What they want to do is help people. I don't think that is probably the same in every healthcare company, but what I do know is what it is in ours, and I think that is what's most important.
I think what it also brought to light for a lot of people was looking at people who were maybe asking for a procedure or asking for some kind of drug and getting turned down, and the percentage of the patients that had been turned down like that, and started those conversations around communities across the country.
Well, and that's why when I talked about gold carding and this really important program, 1,400 physicians in Michigan are in this program. 15 specialties are included in this program, and it's automatic approval once submitted by the physicians for physicians who are prescribing, who are recommending appropriate passive care.
You know, some people who have a choice on the marketplace for their insurance, or employers who are looking to get insurance, what do you think that they should be considering now in 2025 in this landscape and atmosphere?
I think they should be considering Blue Cross.
Well, I mean, it goes without saying.
Well, I think all those factors. Healthcare is a deeply personal decision, and I think I think it has to start there. I think it's really important. There are plans everywhere that can meet specific healthcare needs, and that's why it is so personal, and that's why the concierge services and the people are on the other end of the line to talk people through one-on-one in a very private conversation about what are the things that you most need? What are your personal health conditions? How do we do that in order to make sure that you have that coverage? And then, one of the great benefits of Blue Cross is we have the widest network in the state of Michigan of any health plan. And so it's very wide access, and that's really important to a lot of people, to have that access to be able to go where they need to go when they need to go there.
My thanks to Tricia Keith. Coming up next, the changing face of Flashpoint. Stay with me. And finally, a new path for Flashpoint. I have enjoyed guiding the show through its transition, but I was only holding down the fort temporarily, and I want to bring in your permanent host, Jason Colthorpe. We've got the whole desk cleaned just for you, starting next week.
We're bringing in some folks to look at the wallpaper, possibly.
Yeah.
I don't think, well, first of all, you're not going to notice anything different other than it's me. I'm very excited to carry on what's been just a very important tradition here in Detroit, and that you've carried on, but just the conversations that you've had here throughout and your career in Detroit, along with Devin, and just what I've learned from you guys to have those conversations, talk to those people, and just be able to bring those issues to Detroiters throughout that time. But don't worry about, I feel like I've just bought a very nice older house, and we might throw up a coat of paint.
Older.
But it's a very good house. Maybe a coat of paint here or there. We're going to take a look at the roof along the way, and but we're not going to remodel anything serious.
Excellent, and you'll guide the good conversations.
I'm going to try.
Yeah.
I'm going to try. It's a tall task, and I think I'm up to it.
I think you are as well. All right, Jason, that is going to do it for me. Jason will be back here next week with all of you, and for all of us here at Flashpoint and Local 4, I'm Christy McDonald. Thank you, and take care of yourself.